What is that we tend to ignore out of sheer inattention, busy schedules, and/or hesitation? It is not uncommon to note passage of red-colored urine, which is almost always indicative of presence of blood. This, in medical term, is called hematuria, which is a critical symptom pointing towards possibly serious underlying disease affecting the urinary tract, that is, kidney, ureter, urinary bladder, prostate gland, and urethra. Although some would seek medical advice following an episode of hematuria, yet people commonly tend to believe that this is a result of consuming spicy food or exposure to heat and thus ignore this. Most often, such bleeding stops spontaneously and patients do not seek medical advice subsequently. This allows the underlying disease to progress silently to a serious stage. A timely diagnosis of all these diseases is extremely important for cure.
A late diagnosis can lead to a situation where cure may not be possible.
The symptoms of hematuria. People with hematuria have urine that is pink, red, or brown in color. Even a small amount of blood in the urine can cause urine to change the color. In most cases, people with hematuria do not have other signs and symptoms. Possible causes of hematuria in adults. In hematuria, kidneys or other parts of the urinary tract let blood cells to leak into urine. A number of problems can cause this leakage, including tumor or cancer in urinary bladder or kidney, urinary stones, infection and inflammation of the kidney, urethra, bladder or prostate, tuberculosis, polycystic kidney disease, a genetic disorder in which many cysts grow on a person's kidneys, injury or trauma. Glomerulonephritis, which occurs mostly in children, is a type of kidney disease that involves the glomeruli, small, important structures in the kidneys which become inflamed and impair the kidney's ability to filter urine, causing symptoms like hematuria, lethargy, headache, etc.
Diagnosis of
hematuria. Presence of blood can easily be diagnosed by routine examination of a sample of urine which would confirm presence of red blood cells, that is RBCs. Apart from this, the presence of pus cells in urine indicate an infection. To diagnose hematuria, your urologist or healthcare professional would usually depend on various blood tests, microscopic urine examination, kidney biopsy,
cystoscopic or an endoscopic examination of bladder and urethra,
IVP, that is intravenous urography, a test that uses X-rays and a special dye to help assess your kidneys, ureter, bladder and urethra, a computerized tomography or CT scan. Please note that the tests are recommended depending on the severity of the condition. Why you need to see a doctor after noticing hematuria, that is blood in your urine. First, disease or cause would be diagnosed early. Second, cure would be possible. Third, you might escape a major surgery, which means the removal of the whole kidney, urinary bladder may be avoided. Hematuria is a common symptom often overlooked by the patients out of hesitation, negligence or inattentiveness. However, since the cause of hematuria, that is blood in urine, can be as deadly as cancer or tumor, it is highly important to get a medical checkup as soon as you notice brown, red or pink colored urine. Wishing you a healthy living.